Welcome, Tips to Thrive. Boy, Dr. Fabi, your lips are looking mighty plump. You getting your lips done?
Wouldn't you like to know?
Uh-huh. So which areas of the face do you think are the safest areas of the face to treat?
I think when you look at Katie Belletti's paper and others that have written...
Katie Belenzi's paper.
Yeah,
yep.
and others that have written on blindness, there have never been any cases, at least published in the literature, where the lips alone were injected and that caused blindness.
So you think the lips are one of the safest areas to treat?
It is. And they're in her paper, obviously, the person who got blind, who had the lips injected, had other areas that were injected.
Okay, so what areas do you think are less safe to treat?
I think, obviously, the least safest area is the glabella, the nose, and the forehead.
Yeah. So I think, but if you have someone who's very experienced, and like you and I are, and we teach about this all the time, is if you're going to treat those areas, you really have to know your anatomy. And I'm going to argue you have to be very careful with using a cannula. I think is better. But certainly,
a 22-gauge cannula.
Someone who's experienced is important.
Yes, and it's not just experience. There have been cases of people that are extremely experienced, and so you have to just make sure that the patient is aware that there is that risk, and some patients are willing to take it.
And also that the doctor you're going to knows what to do.
If, in fact, that happens, you're right.
So the 3 tips I think that we should go over is, number 1, know your anatomy, know your safe areas, and know your more riskier areas for problems.
I completely agree.
Number 2 is know how to manage it.
Yes, have adequate hyaluronidase in the practice, have a crash cart.
Okay, and number 3, know who to refer to.
Absolutely, you should be very good friends with a local retinal specialist.
And I'm going to give you a 4th tip, just because we're giving extra tips these days. We post on our walls what to do. So if we have a new MA or a new extended provider, they know exactly what to do, where to go if they have a question.
Yeah, have your checklist available. We have it near our fridge, which is where we have all of the other items if we need to use them.
Can I give a 5th tip?
Okay.
10 vials of hyaluronidase in the office.
Minimum.